Hey everyone, Vanessa here with Visalia Talks, your local talk show that brings you all the latest and greatest of what's going on right here in your community. Today we have with us Tara Norman and Ruthie Prado, physical therapists at Kaweah Health Rehabilitation Hospital. How are you guys?
Doing great.
Good, good. Now today we have a special treat. We want to talk about the new upgrade to your facility, who you guys are and what you guys are even doing here. So what is the Kaweah Health Rehabilitation Hospital?
So Kaweah Health Rehabilitation Hospital is an inpatient facility, and we service many patients who have had a stroke, patients maybe falling, hip fractures, patients who sustain a spinal cord injury or a traumatic brain injury, even lower extremity amputee, motor vehicle accident with multiple trauma, a variety of patients we serve that have some sort of disability, a new disability that requires physical, occupational, and or speech therapy to be able to return back home.
You're teaching them to walk again in this new, maybe you have one leg now and let's learn how to adjust.
Right, or if you had a stroke and you can't use, either you have no movement or very little movement on one side, we're teaching them how to get around again. So all our patients come from a hospital setting primarily.
Okay.
So there's a reason they can't go back home. They're not independent anymore. They need, therapy to get them going and get them safely back home.
Yes, give them back that quality of life.
Correct.
That they would have to figure it out on their own, and who's going to help them with that?
That's right. That's right. Absolutely.
I love that. How long have you guys been doing that here?
So I've been here 26 years.
Oh,
so
wow.
A long time, yes.
Oh, wow.
And I've been here for 17 years.
17 years?
Yeah.
Wow. You guys love what you're doing.
Oh, absolutely.
Yeah, this is a great facility to work for. I remember as a new graduate learning about this facility and just kind of setting my intention to want to become and work here eventually. So we change lives here with our team, and it's just a really great such a wonderful, positive atmosphere that our therapists create for the patients and for their families to come. When you've suffered a major trauma in your life, all of these are unexpected. You have the physical component, but you also have the emotional and the psychological components that go with those major changes in your lives. And our team handles all of that. And it's really amazing to see how well patients go from when they get here to when they discharge. And we frequently have patients come back and see us, show us how they're doing, show us how they've progressed.
It's very rewarding.
It's very rewarding, extremely rewarding. Yeah, it makes you excited to come to work every day.
Oh, that's beautiful. These are inpatients,
outpatients? Inpatients, yes. The ones that Tara and I work with and oversee is inpatient. Yeah.
Nice. Such a rewarding job.
Yeah,
yes, to help, and I bet their families are so appreciative of it as well.
They are, and we involve the family. We want them a part of their rehab. We do extensive training with the family so that they know how to help care for them. And besides the therapy, we do offer, in our inpatient setting, we have on staff physicians that see the patient regularly. We have social workers, we have registered nurses that have, certification in rehab. So that's a whole encompassing care that we provide to the patients.
Round the clock care.
Yes,
round
24/7.
Yes, and it's everything that they need.
Yeah, it's really a privilege for us to be able to, meet these patients where they're at and get to know their families. We a lot of times get to know them on a very personal level. We know their kids' names, their grandchildren's names, the things that they like to do. It's not just about getting up and being able to walk, which is a huge component, but how do we get you back to having the quality of life that you want?
Yes,
or how do we get you on that jump start to get there? We also do a lot of really innovative things with our patients where we take them back out into the community, doing things that they loved before. I just had the opportunity last week to take a patient out to the Ag Center to practice walking because his daughter does barrel racing. And he got to go and watch his daughter do barrel racing while we practice walking on different surfaces, interacting with the community, things that are, we work very, very hard to tailor each patient's therapy to that specific patient and their needs, and what makes them that whole person. It's not just about getting up and moving around the house, but what are the things that you do outside of the home that really are important to you and things that you value.
I love that. Who's able to come here? Who's able to be a patient? And just Visalia
Yes.
residents, anyone in the
So yes, if
county?
you have a qualifying diagnosis,
Mhm.
obviously, within this area is the primary who we serve.
Mhm.
But you know, sometimes, unfortunately, people traveling through the area
Yes.
what may encounter an accident, may be visiting and have a stroke, you know, and so they do come. So we can work with people from anywhere.
Yes.
Right.
If
And
your
our
accident's
goal
here,
is
if you
to
get
be a
stuck here.
center, you know, a designation rehab. So that's why we work to
Oh.
make changes to upgrade, have more things to offer. So we are a
Yes.
designated rehab.
I love that. So this upgrade here, explain to me, what did you guys get done here out here for the patients?
Yeah, so this is our community mobility training course, and Ruthie and I and our entire team have been working for years just to constantly evolve our program, you know, with the latest technology, the latest kind of innovations. And I know this has been a dream of ours for many years. This used to just be kind of a nice park area where patients could come out. And what we wanted to do was basically set up an area where we could train the community and the people in the community to go back to doing community activities. So you probably don't think about it, but when you came in here today, you walked on multiple different surfaces, you went up and down a curb, you balanced a lot of different things. And when you're in a hospital, you walk on very level surfaces, it's open, everything's kind of catered to you. That's not the way real life is.
That's not.
And so our goal is to set patients up for success in real life. So what we have here is we have a ramp, we have multiple different surfaces out here, including various types of rocks, we have cobblestone, we have brick, we have mulch. This is our grass area over here. People that love to go shopping, we have, I call them egg breakers. I don't know what they're actually called, but the little bumps that you go over with your cart, you know, that throw people off balance.
Oh yeah,
little
that's
yellow
this
bumps
right here.
over there.
Oh, egg breakers.
Yeah,
they make things bounce.
Yeah, the things that you experience in your daily life that you don't think about as could possibly, you know, throw you off balance or trip you up.
Absolutely.
These are the things that we wanted out here to let our patients have that practice, because we know that in order to be successful, you have to be able to practice these things before you do them. And this puts you in a safe environment with people who know how to train you and the things that you're doing. So yeah, we really have catered our rehab to, you know, advancing the practice that we provide and the information that we provide to our patients. So even inside in our indoor area, we have some of the latest and greatest technology in there to help get our patients up and mobile early. We utilize the Wii system for, you know, balance and make it kind of fun.
Yes.
We have what's called a safe gate balance and mobility trainer, which we are someone who has the longest track in the nation for this. We're the only one of these devices in the state of California, which is really cool.
For the safe gate.
For the safe gate, yes. And what that does is we can put patients in a harness and we can get patients who are very, very low functioning up sooner and get them moving and on their feet sooner while putting them in a protective
they're being held to walk until they're not being held anymore.
Yeah, basically.
And then we can also use it for patients who are up and moving but need to be challenged. You know, we do fun things. We play baseball with patients in the safe gate, things that they wouldn't feel comfortable necessarily doing outside of a machine that helps kind of hold them up and keeps them from falling. But it allows us to really, you know, challenge those patients at a higher level so they feel much more confident in going home and going back to their normal activities.
Absolutely. I bet you, more importantly, you guys are keeping their spirits lifted.
Yes.
Oh yes.
Yes.
Yes, that's so important because they do. There's an like Tara was saying, there's an emotional component. You know, when they end up in the hospital for whatever reason, for whatever has caused that,
and when you're not the same anymore, it does something to you.
There is an emotional component, so it's important to find what they enjoyed before so we can incorporate that, teach them how they can do it. Maybe it might be a little different. They might have to modify it some, but it's important. Yes, it can be done. And another thing I want to highlight is that we're an inpatient rehab hospital, and we are the only one in Tulare and Kings County. So it's important, you know, for the community to know that this is available to them. And if they are in the hospital, and if they themselves or a loved one is in the hospital, all they got to do is talk to their discharge planner, their case manager, and ask about, I want rehab. I want inpatient rehab, Kaweah Health Rehab Hospital.
Yes.
So that we can serve our community even more is our desire.
Yes. And you know what? I think it's very important for the community to understand actually what you guys do here at the rehab hospital, because I'll tell you right now from personal experience, my grandmother, I helped her, and she was in the hospital a couple of months ago, and it was really bad. And they asked me, do you want to put her in a rehab hospital, and I think they meant this one, or we can have the physical therapist go to your house. And if I knew that this is actually what was going on here, I would have sent her here.
Yes.
But we had the physical therapist come to the house and all of that. It was Kaweah Health physical therapist, but this is absolutely amazing. I bet you she would have gotten so much more out of this.
Home health is wonderful, but they only come out 2 or 3 times a week, maybe.
Right.
Versus you're here. Yeah, here you're getting 5 days, 3 hours of therapy, 5 days a week at minimum. Yeah. So
and I know how much
it's
I would have helped her.
intensive. So but it's intensive, but don't be worried about, oh, is it going to be too much?
No,
we know how to pace it, spread it out to kind of to help the patients be able to tolerate as well.
Absolutely. So you guys got the ramps out here, the different textures for them to learn to walk in. You've got other machines and all kinds of stuff inside for them.
Absolutely. We have a really large gym. It's really basically all these windows you can see is the whole length of our gym. So it's a pretty large area. A lot of equipment and devices to help patients get back home.
I love that. And is there anything else you guys would like to share with the community?
Yeah, I think I just want the community to know that we have a really amazing multidisciplinary team here. Like Ruthie was mentioning, all the different disciplines that work with each of the individuals as they come in here. They are highly trained, highly skilled, lots of specialization training over there, but they're also extremely compassionate. Our team has probably the biggest hearts in the community.
That makes a difference.
It does. They have this huge desire. They see the patient as a whole person. They don't look at the disease or the disability that they're presented with. They see the patient as a whole person.
Or their insurance.
Yes, absolutely. And they have such a big heart for the community and returning people to their homes. And I think that's something else I want to highlight is we have a very, very high return to community success rate.
We do.
And that's something that we're very proud of. We've had that for many, many years. But we get patients home. We get them back with their families doing the things that they want to do. Like Ruthie said, maybe a little bit differently.
Yeah.
But
they're doing it.
Right. They're still doing it. And then we're here for them, even after they go home. That we're here to support them. We've had patients come in that are celebrating and excited to show us things. We have other patients that have come back and they've had a hard thing happen, and we support them through that as well. It doesn't just change because you've discharged out of our hospital. You kind of our patients become a member of the rehab family.
They do.
I love that.
They love to come back and visit, show all their improvements. And so that just shows how much the care and compassion that is provided, because if that didn't happen,
they wouldn't be
coming back. They love to come back and see their therapists, the nurses, the whole team.
Yes, I commend you ladies for what you're doing, for all the help that the hospital is doing and everything. I mean, obviously you guys love what you're doing to be here as long as you have, to not even waver whether you're coming. It's a beautiful thing when you get to enjoy what you're doing every day.
Yes, and absolutely.
And we're not stopping. We are continually looking for ways to grow and improve our program. We have big dreams. The funds for this was donated to us by Mason Law. We have big dreams to continue to develop that, to support our agricultural community as well. To do gardening and different things. So we have big dreams to just keep expanding this program as with everything that we have.
And involving the community in it.
Absolutely.
I love that. How else can the community get involved with what you guys are doing here? Do you guys do donations?
We
do. Anything like that?
Love donations. This was donated. We put a plaque up. We did a ribbon cutting, so there's things that we can do if they want to donate, to give them the acknowledgement and recognition for that. So
I'm sure there's plenty of stuff that you guys can use here for your patients.
Absolutely.
It's just not in the budget right now.
We want the best for the Valley, the absolute best for the Valley.
I love that. Thank you, ladies, for talking with us today. You're welcome. We're going to be showing pictures from inside and all of that. So thank you for letting us come in here and take over your afternoon.
No problem.
All right. Thank you.
Thank you. We'll see you.